This segment will show various positioning devices to assist in holding and restraining patients, providing a decreased exposure of the technicians and in some cases allowing the technicians to be completely out of the room. Also, the use of these devices will increase the accuracy of the positioning, thus reducing retakes due to motion and poor positioning. There are many positioning devices which can be used to assist to allow you to stay farther away from the animal during the exposure. Sandbags can be very beneficial in that they can be taken and formed in order to allow you to position an animal and tend to hold it. You can use a sandbag as a weight when you're trying to hold down an extremity or something. The problem with a sandbag is that you cannot have a sandbag in the beam over the anatomy, or you will be distorting the quality of the radiograph. But sandbags can be very useful in making various positions. Another device which is very useful when making a ventral dorsal radiograph is a positioner, and this one is made out of plexiglass with foam rubber on the sides so that the animal can be placed in this area on their back and the animal will be much more comfortable during the exposure of the radiograph. With the animal in this sort of a comfortable position, you can then often tape the extremities and again get completely away from the animal and out of the room for the exposure. Other supplies which can be very useful to you in positioning the animal are wedges of various sizes which can be slid under an animal and hold up a head or straighten up a thorax when you're trying to make a true lateral thorax. Small sponges which can be used to cushion an animal that is lying on the hard table, and as long as these are foam rubber and are soft, they will allow the animal the more comfort and easier positioning during the exposure. The other items which can be used to tape and extend extremities or various parts of the body is often used in gauze or tape. We will show during the actual filming of the various positions how many of these can be used to assist you and allow you to get out of the room during the exposure. In large animal radiology, one of the real problems that you have is holding the cassette during the radiograph. There are no tables or any other accessories that are standard in large animal radiology. If you have to handhold the cassette, it is almost impossible to get your hands out of the primary beam. Therefore, in large animal, you need to consider devices which will hold the cassette and allow you the opportunity to be back from the primary beam. These are handmade devices which allow the cassette to be held vertically, and then you can see your hands can get away from where the primary beam will be striking the cassette. This provides you a great degree of safety. These come in many different forms and shapes depending on what part of the body that you're wanting to radiograph. The one shown here is good for being down at the foot or the fetlock or up to the carpus and the hock. They come in other designs so that they can be held in different ways. This one shows one where the cassette is loaded from the top so that the edge of the film is to the top. With this type of cassette holder, the cassette can be put up higher into the flank or into the elbow region where you do not get any cutoff at the top. This one shows handles which allow you to grip the device and better bounce it and to put pressure on holding the cassette up into the flank. There is still some strain in supporting the weight of the cassette on this type of holder. The other type of holder which is available and can be made is one where a leg has been made for the holder so that the leg is adjustable, and this allows you then to stand back even farther as the exposure is being made. Remembering that the farther away from the cassette and the exposure that you get, the less radiation you're going to see. This one is designed with a ring and a bolt, showing this leg can be moved up and down so that you can adjust it depending on what part of the body that you are radiographing. A very useful instrument for positioning and studying the cassette during the exposure. For those that do not have a friend in the welding business, we have this inexpensive version where the cassette is taped onto an old groove, but it provides you with the instrument to get back and allow the exposure to be made and keeping you away from the X-ray beam. This can be done by anybody under almost any circumstances to provide a safer procedure for large animal radiography. Numerous special purpose blocks can be used in radiographing horses' feet. This shows approximately a 2-inch thick block of which you can place a cassette on the ground, and the block will support this cassette, and with the horse's leg in this position, again, you can get completely away and not be exposed to any radiation. The Hickman block is a special block which is made, which has a groove where that horizontal beam can be used the same way, but the primary purpose is where the cassette can be held at approximately a 45-degree angle, and the horse's foot can be placed on the block, and then a DP view can be made of the foot. This is the most useful method in looking at the navicular bone on the horse. And then in some views where you want the horse to stand on a device, this shows a plexiglass top on the cassette holder with a wooden rim around the edge. The cassette is placed inside of this holder, and then it can be positioned on the floor. The horse then can stand on the plexiglass, and the plexiglass will support their weight so that no damage will occur to the cassette as the horse is bearing its weight and the radiograph is being made.
This segment will show collimation of the beam and how it can be used to reduce the exposure to personnel by reducing the field size exposed to the radiation. This collimation of the beam also will result in an improved quality of the radiograph by reducing dramatically the scatter radiation. In addition to that, special angles of the tube head and cassette will be shown, and methods of obtaining more accurate and clearer images for interpretation.
A collimator has two primary advantages when making a radiograph. Number one is it offers an alternative to continuously adjust the field size so that you can match the field size with the anatomical part that is being radiographed. The anatomical field size then can be adjusted in both directions. In addition to that, the majority of collimators have illuminators which give you a field of illumination indicating the size of the field that is being exposed. This shows the lighted field, which is indicated by the collimator, and you can see that the field size can be adjusted by changing the leaves and the dials on the collimation. If, for example, you are doing tabletop work and want to split a cassette and make two images, you can actually adjust the collimator down to the point where the field size will allow you to make an exposure on this end of the cassette, and then you can move the cassette to the other end and repeat the other exposure at this end. In all cases, it is recommended that the field size be less than the size of the cassette so that we can guarantee that you have controlled the beam during the exposure. This shows a good image that with most collimations there is an X indicating where the center of the beam is as you're positioning the animal. The other thing is that when you're making a full cassette exposure, the collimation should be inside the edge of the cassette, indicating that the beam was restricted properly and that the film was made with good safety technique. Most tables will have a dark line down the middle so that you can get the tube and the cassette centered properly. Then once the film size and the restrictive beam is determined, then many machines will throw a light out to the edge so that you can make sure that the bucky tray, as you slide it under the table, will be properly aligned with the beam and the image that you have seen on top of the table. Most small animal machines will have a collimator attached to the X-ray tube. The collimator provides 2 or 3 distinct advantages. Number one is that you have a continuous adjustment of the size of the field of radiation in both directions so that you can use only the field size necessary to cover the anatomical part being radiographed. The second one is that most of them will have a light source which also lights that field during the adjustment so that you can see what's going on. Another characteristic that many machines will have is a dial which shows you whether the machine and the tube is vertical or whether it is angled. When you're doing most routine work, you need to be sure that the tube is vertical so that the best image is obtained for that radiograph. A concern which you must always be aware of is making sure that the tube is always vertical when you're making routine radiographs. We do use angled shots in many cases, but once you have used an angle shot, then you need to make sure that the tube is perpendicular to the table. Some machines have indicators which tell you when the tube is vertical. If you do not have that, then the next best way is to push the tube and the collimator against the table to make sure that they are parallel with the table, and then you can push the tube back up to its normal focal film distance for the remainder of the radiographs. Horizontal beam radiology can be done by the use of a wall holder such as demonstrated here, where the holder is the method of restraining and positioning the cassette in a vertical position. This one has been so aligned that when the cassette is ready to go, the tabletop can be pushed over to the edge so that the animal can be positioned on the table and receive or get your image made. The tube then must be brought down and aligned with the cassette with the lighted beam collimator. You can see the image that you're going to get for the restricted field, and it can be adjusted to fit the anatomical part that you're radiographing in the horizontal beam. Another more versatile type of horizontal beam cassette holder is this one, which is movable and can be placed almost anywhere and adapt to horizontal beam radiology. The cassette is placed into the holder and then it is aligned with the machine so that you can align your proper image onto the cassette, and then the animal is placed in this position so that the radiograph would be produced on the cassette. When portable X-ray machines are being used, particularly in large animal radiology, they are often packed with no restricting advice whatsoever on the beam, so they can be very dangerous when used in this manner. Most of them come with some sort of a restricting device which can be inserted over the window of the X-ray tube. This housing provides some restriction of the beam, but it is still designed to cover a fairly large cassette. If you're using a smaller cassette, then most of these devices make smaller insert windows which can be placed into the device, which further restricts the beam to a smaller area and allows you to more safely produce a radiograph. These devices do not have lights, so in order to be able to know where you are aiming the machine and to get the proper angle of the machine to the cassette, there is a pointer that comes with the machine which can be snapped down in place, and then as this device is extended, it tells you the proper distance that the film must be away from the X-ray machine. After the proper distance is determined, before the film is exposed, the pointer device then must be brought back up into this position so it does not interfere with the production of the X-ray.
This videotape is on the radiographic techniques and radiation safety training for veterinary technicians. The radiologists involved in the production are Robert Lewis, Mary Mahaffey, Barbara Seltzer, and Elizabeth Watson. All four are diplomates of the American College of Veterinary Radiology and are associated with the Department of Anatomy and Radiology, College of Veterinary Medicine, the University of Georgia. Technical assistance was provided by Tim Jarrett and Ann Toth. The production manager was Gary Burton of the Educational Resources Center of the College of Veterinary Medicine. This videotape was sponsored by the Georgia Veterinary Medical Association, located in Norcross, Georgia. Financial assistance was provided by the Atlanta X-Ray Sales and Service of Duluth, Georgia.